Trick-or-treating can be done safely. We'll have to remember that walking around outside in small groups, socially distanced, staying with people in our social bubble is largely what we've been told to do during this pandemic in terms of getting activity. And trick-or-treating is largely that, as long as we can avoid other people. So the part that really needs to be figured out is the candy delivery methodology, right? And so I think that's what people have been getting really creative about. I've heard some really good ideas coming out of the community on that. So people are talking about putting bags attached by clothespins to a clothesline so kids can take one off without reaching into a communal bowl, or using a tube or a hockey stick or some kind of distance, or very long tongs as a way of delivering candy to kids. And so I think there's a lot of creativity in ways that people are really rising to the challenge. One pretty good news piece out of the pandemic is that transmission through fomites, that's the word that we use for when a virus is on a surface like a doorknob or a candy wrapper and then gets transmitted. It's not as big of a problem as we feared earlier in the epidemic, but that doesn't mean that it doesn't happen. And in fact, we know that there are quite a substantial minority of new cases where actual risk can't be determined. And there are certainly cases where people who are quite clear that they've been staying home have gotten the virus anyway. And so we still do need to be concerned to some extent about that. But remember that the virus, while it can survive, some small amount can survive for a long time, its half-life, the period at which half of it is gone, is much shorter. So people may want to think about allowing their kids to collect candy, but then either having parents open it, remove the candy, and then wash their hands and do that in a strategic way, or let the candy sit around for a couple of days before opening it. And that could be a parenting challenge in terms of having the candy sit around, but it could also have the side effect of preventing that day after Halloween scenario where all the kids are sleep deprived and just buzzing on sugar. Well, what I worry about on Halloween are a couple of things, and one is a social thing. So if you're a parent and you're taking your children out, we have in general a shared idea of how this is going to work, that people will find some socially distanced way of doing this, that everybody will be wearing masks. But you want to think in advance what you're going to do if you approach a house, the light is on, it's clearly, they're in business for Halloween trick-or-treating, and somebody comes out without a mask, worst case scenario, they cough into their sleeve, and then they ask your kid to come and grab something out of a bowl. So you want to kind of think through those scenarios in advance and think how you're going to, because it's socially awkward, right? But how you're going to kind of say no to that situation, or maybe having those conversations with your kids in advance. And a lot of people have had a lot of these conversations with their kids over the pandemic about what may and may not make sense for them to do. But I think it's good to strategize around that. The other thing that needs a little bit of thinking about is the issue with masks. And so if everybody's masked, of course, on Halloween, people often wear costume masks. And now we're asking people to also wear a non-medical mask, a fabric or a disposable mask. And so you really want to think about making sure you're doing that in a way that's not going to impact breathing. And so I would think about whether there are ways to make the non-medical mask a part of the costume instead of putting something else over the top of it, if that's possible. So are there ways that you could design that, or you could paint it, or you could have that be part of the face covering so that you're not layering multiple things over a kid's face? And so that's something that's a little bit different. Like a mask, non-medical mask, could actually work very well with Halloween. It could be part of a costume. I can picture lots of doctors and nurse zombies this year and things like that. Or it can be done, it can be painted up in some way and decorated and be part of the costume as well. But I think that might end up being a problem for people who want to wear like the kind of rubber face masks and things that people sometimes wear on Halloween. So I think that's just a special costume consideration for this year as well, in terms of both safety with regard to COVID and safety generally. I think what's important here is that we're still sticking with our own households or social bubbles. I know we've been told to move away from that a bit in some areas, but sticking with that group of people with whom we have an agreement and we've been interacting with on a regular basis, and not expanding it just because it's a holiday. And so there, I think it's really important to think about, what can I do with the people who I'm already in contact with, and what can I do that's going to be as safe as possible? Because it is really important for us to maintain these traditions, and it's important for us to have these these kind of annual rituals and celebrations and not take all of the fun out of life. At the same time, it does mean we're going to be doing things differently, and that might mean some people are connected via video. You can have video costume parties. I know early in the epidemic, I knew people who were going out video clubbing and having dance parties, online at video nightclubs. And certainly costumes would be a great thing to be able to see everybody's costumes, even if you can't be with them in person. So I just think we need to get a little bit creative this year about how we do that. And maybe we'll establish some new traditions that we can take forward. Maybe we'll discover some things that actually work really well in the context of having to be more creative this year. So right now, the provincial hot spots are in Ottawa, in Toronto, in York Region, and Peel Region. And these are areas where the numbers are up. They're areas where, in some cases, testing is lagging behind and there's a delay. And when there's a delay in getting results from testing, that also means a delay in contact tracing. So, of course, when you're trying to trace contacts 4 or 5 days later than an ideal scenario, it's a situation where the virus could have spread from those people, to others already at that time point. And so those are areas where we really need to be extra cautious, and where the province has recommended that people forgo trick-or-treating for this year and find alternative ways to celebrate.